Welcome to the Introduction for Medical Ethics. My name is Dr. LaVon Downey. I'm very well published. I have over 110 publications in medicine, medical journals, over 900 citations, so I'm pretty well known in the field. I also do a whole lot of stuff with NGOs that deal with global health, the United Nations, One.org, and we have lots of organizations on campus, so let me know if any of you are interested in joining us. We do a whole lot of stuff. We change legislation, we get legislation passed, we have a big global health impact. So if you want to do advocacy, please join me. Just reach out to me via my email. One of the things that I wanted to talk about when I talk about the introduction to medical ethics is that most of you think of medical ethics as the right to die, those kinds of things. And this class is a little bit more expansive. It does talk about those issues, but it also talks about those issues embedded in how do we become ethical and how do we act ethical, not just towards patients or as healthcare providers or as auxiliary healthcare providers, but also how do we provide ethical work situations? How do we treat not just the patients, but the providers, the other healthcare workers, the other healthcare assistants in this system? Because part of what you're doing in medical ethics is also learning how to be an ethical administrator and an ethical leader. And you need to sort of go through what all the old white guys think to sort of see how a system's approach to thinking can impact how you view what is a good outcome and what isn't a good outcome. It also, one of the things we talk about is the role of culture and dealing with patients and physicians and other healthcare workers, including administrative people who all come from a different place. They need to understand your mission. This mission in medicine in America is also very much embedded in how it's financed. So funding equals function. No mission is going to happen without money. So you have to be a little bit aware of where the money is coming from, maybe in a way to be more expansive about getting different ways to fund things, not being reliant on one specific way to get, i.e. through third-party payments, to get this innovative ethical approach to healthcare that you want to be providing. One of the things too in medical ethics is we want to talk about the community we serve. We're not just building a widget, we are talking about a community's health. And if we want to have more ethical outward facing, we have to then talk about the ethics of how the community's health is. Do they live in a food desert? Do they not have enough providers? Do we not provide services that are convenient to them? Do we not educate them enough about lifestyle choices that impact their health care? That's a sort of different way to think about ethics, but isn't it our responsibility as health administrators to then go out and make sure that that happens? Who do we partner with? Also, how do we ethically treat people in the hospital and as administrators and leaders? And we need to think about that. How do we ethically use technology? Because technology, America excels in healthcare as far as technology and science, but we're not very effective or efficient in getting good outcomes for our patients and making people healthier. And is that an ethical thing that you want to do? Should all the money go towards every technology? Or should we pick and choose what technology we do and what impact it has on the patients, long-term, short-term, and who gets access to that technology? These are all things you need to think about as health administrators that you wouldn't have to think about in other fields. Also, how do we ethically treat our co-workers? Do we understand, do we train them enough? Do we give them enough tools so that they can ethically be present and be purposeful with the patients and with the community that they serve? Another component that we talk about later is advocacy, and I talked about that previously in this introduction. I talked about the United Nations, One.org, Global Health, the Affordable Care Act. We've done stuff with that too. How do we make sure that we are advocating for better systems of care for everybody? So healthcare and whether you live or die or the quality of your life is not dependent on where you were born or what city you live in. And are we advocating for ethical healthcare for everyone, ethical outcomes for everyone? And as a health administrator, you are going to be an advocate. You are going to ask Congress for things. You are going to make sure that there's funding that goes towards the need. You're going to probably see a bigger picture, and you're going to be a resource for legislators, state, local, federal level, even global level, to help them improve in an ethical way the healthcare system, whether that's public health or incidence health. Your role is very expansive, and that's one of the reasons why you learn all the things you learn in this class.